you have your money, and how are you gonna do your research? Well, you need if you want to cook, you need ingredients, right? If you want to do research, you need raw data. So where are you gonna get the raw data? Well, the traditional institutions didn't fund for your research. Do you think they will open up data for you? Right? It's going to be difficult there. It's another difficult situation. So that's, I think, where Hippocrat comes in as the decentralized data hub for decentralized scientists. I think it really, it completes what decentralized science is. Funding is one part of science that's being decentralized. Now we need data provision that needs to be decentralized, and we work on providing that raw data for decentralized science.
So, hello everyone, welcome back to the DeSci Podcast. It's been a busy couple of months for us, but we're excited to get back into the podcast recording. Today, I will be chatting to Justin from Hippocrat. Hippocrat has been in the DeSci space for a while and has sort of a number of different initiatives going on. They've got a token, they've got a DAO, they've got a DApp. So yeah, really excited to sort of dig into what they do a little bit more. And yeah, I think just find out how to get involved with what they do, because it's pretty cool. It's all about data sovereignty. Let's get going. So Justin, can you tell me a little bit about what Hippocrat does?
All right. Well, thanks for inviting me today, Ella. I'll be honored to give you a little introduction of what we do. So Hippocrat, we are basically a collaborative data protocol for health data specifically to be collected and utilized. So what we do is we try to enhance health data's sovereignty, openness, and decentralized usage. As you see, our name Hippocrat is actually derived from the ancient Greek physician named Hippocrates. You probably know it as it's very famous. Yeah, he's very famous, so you probably know. Following his mission, we're trying to empower individuals to basically gain over their health data so they can utilize it for personalized service and make data-driven decisions.
That sounds really cool. Yeah, I think the Hippocratic Oath, which is the sort of oath that doctors take to, serve their patients, is derived from Hippocrates. Data, health data and data sovereignty, what does that really mean? And what problem is it?
So, I'm sure many people are not really familiar with the concept of data sovereignty, but, it's basically meaning true ownership over your data. So here's a good example. If you own something, right, you should have full control of it. So you own, let's say you own a smartphone. You can throw it away, you can break it, you can give it to someone, and you can do whatever you want with it. But what about your health data? You have full control of it. So yes, in fact, you legally have ownership of your data, but you cannot utilize it as much as you might want to. So one good example is that I know a lot of countries in the world, especially America, it's really hard to transfer your health data records or your medical records from, let's say, hospital A to hospital B. So legally speaking, the hospitals are required to do so, but there are some regulations over health data that makes it difficult to be, even moved, even transferred, even upon your own request. And now imagine how hard it would be to actually derive values from those data. It's almost impossible. So the big problem here is that health data is being generated so much, especially these days with all the digitalized devices. It takes up to 30% of entire data generated in the world. That's 30% of every day. All the data is health related data. It's crazy amount. But yet 97% of that is not being utilized. So big problem is that the health data, let's say, issuers like hospitals or like health tech companies, they do not want to share data because they're afraid of breaching personal information. Because they store your data, but they might be asked for responsibility if they give it to some other institution to utilize it, for example, like drug development or just analysis. It's the regulation is very strict there. So lots of times those institutions even they're even reluctant to share your own data upon your own request. That's because of the bureaucratic hassle. So that's where the data sovereignty comes. It means I'm gonna explain about the technology later, but with blockchain technology, you can technically own, store, and share your data in the decentralized network. In that sense, your data will be linked to your DID, and you finally have true ownership over your data, meaning you can do whatever you want with it. You can, you can share it to your new doctor in the town. You can feed it to AI for your own personalized healthcare. You can even sell it to a, pharma company.
It is so interesting. I didn't know that sort of 30% of all data collected was healthcare data, and I think it's something that makes sense. I've got my watch on at the moment, and we all are actually measuring our data so well. I mean, my phone knows how many steps I'm taking, that sort of thing. And so it makes sense that there should be a way to use this data that we're sort of producing. I think for me, I also understand like blockchain allows you to create this sort of immutable record of ownership, which I think hasn't been able to do before, which is a really amazing sort of use case of DeSci, decentralized science and data sovereignty. I would be fascinated to know, so you were saying that basically like between hospitals there's a really difficult lack of transfer of information, and that's even though that we technically own our data, the hospitals hold it. So in essence, would you be saying that we would sort of be able to hold our own data and take it to our medical provider? Say for example, I visit a GP and I've got like my health record on the blockchain, and I can give them access to that?
Yes, that's exactly right. As you said, so if you want to utilize a Hippocrat service, you will have to first get your data from your hospital. Then once you, let's say, upload it on our blockchain, then it's free to be used for any purpose.
Super interesting.
Yeah, let's talk about technology a bit more later.
But I think also I think what would be great is also to understand how you guys got here, what your journey into sort of doing this Web3 healthcare data sort of initiative, where that came from, what inspired you guys to get into it, and a little bit about your history.
Yeah, so my name is Justin, and I am a head of growth at Hippocrat. So I'm involved in business development and marketing. I would say I'm only speaking on behalf of our executive lead, whose name is Hyunsub Choi, and he's the one that's actually been making all the achievements, not me. I'm just a messenger. So I would like to introduce a bit about our history, right? Not my history. Our history is more important. So Hyunsub Choi, right? He's a startup founder. He started this healthcare startup called Humanscape 7 years ago with two of his friends. And Humanscape, even at the Humanscape, their mission was to basically work with bringing data sovereignty for health data. And the Hippocrat used to be called Humanscape until we rebranded it recently, which is last year. So, what happened those 7 years? Hyunsub Choi, we call him HS, started with 3 people in the company, grew up to 100, and they focused more on the Web2 business. So they have over 90% of market share regarding pregnancy management application in Korea, and they have expanded to America and Indonesia as well. and they have another application called Rare Note, which is a community for rare disease people with rare diseases. So, their Web2 business was very successful, starting with 3 people. Now they have 100 employees. And HS had always had his heart in blockchain that it could really revolutionize healthcare. So he got separated from the Humanscape and rebranded it called Hippocrat, which is our current project. So we do have very good relationship with Humanscape, and all the network that HS built during his time in Humanscape is now something that we can access as Hippocrat as well. So this is really great because again, with healthcare industry, I think working with existing institutions that holds health data is probably the most important. And he has access to all those network. And HS he himself is a programmer, so he has a very deep understanding of blockchain, and he knows how to, work things out. So we do have very strong team right now. So that's a brief introduction of how Hippocrat was born and what it was before. Our token was listed in Upbit in 2017, I think. Upbit is the number one crypto exchange in Korea. That's it. We have many holders in Korea, but again, the reason of rebranding was also to expand to a global market. So we are currently working with many centralized exchanges to list our token right now.
I would be so curious to know what the experience was moving from Web2 healthcare to Web3 healthcare. Like what were the challenges that you guys faced? Because hopefully I hope that other companies are able to take this direction as well. So I would love to sort of hear your learnings about that.
Yeah, I could probably tell you if I was HMs himself, but I'm not. So
Okay.
I'll try to invite him
Of
next
course,
time. Okay.
yes, I'd love to
But
meet him.
I'm sure there were many challenges. Probably explaining to institutions, doctors. He works with many doctors. He works with many healthcare institutions, and basically explaining to them what blockchain is and how blockchain technology could really improve current healthcare. I think educating the current healthcare personnel probably was the hardest, and he's still doing that. He's still meeting people, explaining how blockchain technology could improve healthcare.
Yeah, definitely. I know at Molecule we have very much the same, I wouldn't call it an issue, but kind of challenge, which is just finding a way to explain blockchain in a way that doesn't feel scary. And that it, I think also like to dispel sort of the narrative around crypto that it's kind of, for hype cycles, and it's maybe for like less serious activities, and trying to explain like how that there's a real potential to like sort of make these world-changing technologies. If you just go outside maybe the common understanding of or misconceptions about crypto. Healthcare data obviously is exceptionally valuable in a number of ways. It's it's valuable to the person it belongs to, but also it's valuable for sort of drug trials, and it's valuable for just understanding like general population trends. Data security is also another huge issue. So I wanted to sort of know how you guys see data security for healthcare like evolving over the next 10 years, and like how you guys might play a role in that.
Yeah, so again, one problem was that health data currently we have a lot of them, but not nearly none of them are being utilized because of the data sovereignty issue. That's one problem. Second problem that we're trying to solve is data breaches that happen all the time in Web2 industry. So there are many cases of like hackers, hacking those data issuing institutions to steal health data, and which is in centralized model you only need to break into one centralized server, right? So so I wouldn't say it's easy, but it's possible to break into those servers and basically steal all the available data. And it has happened, especially recently with 23andMe, where hackers stole a bunch of data. You know,
Totally, yeah.
it's crazy. You know, if hackers really want to, break into, those servers, they could. So, how can we prevent it? Well, if you use decentralized server, it's impossible to break into those data, or yeah,
Yeah,
it's impossible to
yeah.
hack decentralized servers. So second problem we're trying to solve is basically, like you said, the data security.
Okay, and how does your guys'
So,
technology sort of improve data security in that sense?
so let me give a brief flow of how data, works in our ecosystem. So first is DID generation. So your DID is generated, and everything that links to your DID will basically, prove that, oh, this is from you. This is from Ella, because it's from Ella's
Can you
DID.
can you explain what a DID
So,
is?
oh, DID is a decentralized identifier. So it's a hash code that tells you who you are, just like your Gmail. Like, if you want to log into different services, in that sense, identifier is your Gmail or your Apple account. So DID works the same way. You want to, prove that you are you, that you want to prove that, oh, I'm Ella, I'm Justin, your DID says that. So, your Gmail says Ella at Gmail, and they know, oh, yeah, it's Ella Gmail, address. It works the same. So first, DID is generated, then your DID kind of works as your personal data vault, where you can basically store, all your data. And technically speaking, you don't store anything on your DID, but it's easier to it's easier to visualize it in this sense. So where is it being stored? Well, we're thinking IPFS. So what we're doing is we are basically storing your health data. For example, you have your medical records from a hospital, right? We'll link it to your DID and store it in the IPFS.
IPFS being?
Oh, IPFS is a decentralized storage ran by Filecoin. So that's the protocol that we'll be using for storing the data. So there are, many data storage protocols out there, but we currently do not have enough resources to create our own decentralized storage. So we decided to use
Yeah.
IPFS
Yeah,
in
no,
this sense. So it'll be,
yeah. Sorry, continue.
yeah. Before it goes into IPFS, it's encrypted with our technology called decentralized key management. So, when you make a wallet, when you make a MetaMask wallet, you have public key and your private key, right? And your private key is the 12 words, the seed phrase. So as long as you have your private key, you can access to your MetaMask, your wallet. So what decentralized key management do is that it splits up your private keys to decentralized server. And whenever condition is met, it will gather and open up the data for you. So for example, so it basically allows for non-interactive data transfers. Let me go back to the start. So why do you want to use our DID? Why do you want to, store your health data on IPFS? Why do you want to do all this? So we're trying to facilitate seamless collaboration between individuals, health data issuers, and health data users. So individuals will be you and I, who generates health data. Health data issuers are hospitals or healthcare companies that checks for you and refine your data into workable data set. And data users are health insurance companies or pharma company or research institutions who wants to use the health data. So we're So we're a protocol that basically connects all those three entities. And the start of that is storing data on the decentralized server. And then once it's stored, then you'll be able to share with different healthcare providers or sell it to pharma company. All right, so now it makes more sense, right?
That makes total sense.
Yeah. So how do we do it? Yeah. How do you do it? So technically speaking, I'm gonna go through it very fast in the one go, okay, and explain the detail. So the ID created, right? That's your vault, and we encrypt your data into your DID, and then uh, in the data marketplace, we use ZK technology, so the data users can search the specific data set they want without knowing your personal information. So that solves the personal information breach issue. There's no issue there. So that's where the ZK comes in, and that's what makes the data sovereignty, even though it's being utilized. Then, on the other hand, we have our own private vector DB that can feed the health data to AIs, any LLMs, without, again, breaching the personal information, personal identifiers. So that's also done in the ZK manner. So that's a whole flow. What we do, we collect data and we make sure it's utilized for the data owners themselves, and they get the incentives for contributing. Would you like to hear more about the tech side?
Would you like to tell me more about the tech side? Yes, I think it's interesting. I think I'm just sort of piecing the story together in my head, and I think it makes complete sense to sort of connect those three role players together and create this sort of like flow of information. I think I would really love to understand a little bit more. So I know you guys, I can understand from the tech side, but I know you guys also have a token, you've got a DApp, and you've got telemedicine sort of function going on, and even a DAO. So I think I'd love to understand how that all pieces together as well in your broader ecosystem.
Yeah, so let's start with token, right? So our token is listed on Upbit, Korea's #1 exchange. We're looking for more central exchange. We're currently working with them to list them. It's gonna happen soon. I cannot tell you the details because it would be breaking the agreement. On the other hand, so what's the APO token for, right? What's the utility? So I just basically gave you our data ecosystem, right? Our data marketplace. So HPO token will be native token that will be used for any of these service built upon our data protocol. So data marketplace is one, let's say, service that's built upon our protocol. And if you're a payer, right? If I'm a researcher, I need certain data. You come to our data marketplace, use ZK filter, find the data you want, and you will have to pay with HPO token. And the data owners will receive incentives in HPO token as well. So that's one way that HPO token will be utilized. The other side, we're building, the apps that is also built on top of our data protocol. So telemedicine application, it's one good example that we are doing right now. For now, planning side, we're gonna allow both fiat payment and HPO token payment, but we're probably gonna give more advantages to those who use HPO token for using our telemedicine application. So point is you upload your data on HPO data ecosystem, our protocol, and then you'll be able to share with any doctors through a telemedicine application. So that's one way that really good example of how data is used for personalized healthcare. And because it's decentralized, we are able to offer better prices for one consultation because we only take the network transaction fees. So the lower cost will go to goes for the advantage of the users. Yep, that's how HPL token is utilized. In other way, it also acts as a governance token for our Hippocrat DAO. Right now, we haven't launched our DAO yet, but that's where we are heading and what we're planning to do in near future. And DAO is about developing our ecosystem, building more dApps, how dApps where our data protocol could be effective. So yes, that's yeah. HPL token is used for utility purpose and governance purpose, and now we're currently working on to launch it.
Amazing. Yeah, I love how much you guys have fully embraced sort of the DeSci ethos and like a lot of the tooling that exists in the DeSci ecosystem to sort of build out this what feels like a quite well thought out wide sort of movement rather than company, which I think is really admirable. Yeah. So I also think there might be a little bit of a gift for the listeners in the form of an airdrop, if you would like to give them details on that.
So again, we'd like to do airdrop of HPL token to those who are listening right now. So I'm sure Ella will share the airdrop event link to the DeSci Podcast community. This airdrop is dedicated only to DeSci Podcast community, so it's only for you guys. It's a very small one, but hopefully a lot of people will get interested in our project and would like to get some of our token before it lists on the centralized exchange.
Amazing. Yeah, if I could claim that airdrop myself, I would, but I think that is a little bit rude because I definitely have first dibs there. Cool. I also see that you guys have recently done a collaboration with Research Hub. Research Hub, we've had them on this podcast before. They're also quite well known in the DeSci space. They sort of work in reworking academic publishing. But yeah, we'd love to know more about what you guys have done with them.
Oh yeah, so yes, Research Hub. We've been working with them on research, a collaborative research on effective telemedicine interventions in medically underserved areas. So one mission of Hippocrat is, again, make sure you're incentivized for your data. Second is you should be able to use your data for your own personalized healthcare. And that initiative was our telemedicine application, Hippodoc. We want to, so the other way incentivization is data marketplace that we're building. Your personalized healthcare was Hippodoc. The beta test is going right now. We're working on how, and while we are thinking how it could be really be more effective, because when we were building in the beginning, we did not really target such groups. We just thought, hey, having this kind of blockchain-based telemedicine application, could be useful. But we weren't sure of where exactly, needed that. So we worked with Research Hub to basically deploy, decentralized research on identifying, who and where they might be effectively using our telemedicine application. So the first phase of the research was doing a literature review on current landscape. We identified a few areas like Middle East, immigrant population in America, Puerto Rico, India, Europe. And the literature review, the first part of the research is finished. So the paper is probably published right now for listeners who are listening this later. So it's probably published now, and you probably you should be able to find it on Research Hub platform. Look up Hippocrat DAO, and you'll be there if you're interested on how we're trying to solve the problem. So we will further build our telemedicine application based off of the result of this research. Second part of research is starting, which is actually about doing a survey on those populations that we identified. So first part of the research, we identified regions and populations. Then we came up with few interview questions that we can ask and further gain insights on the situation. And based off of these insights, we want to further cater our telemedicine application Hippodoc, and we would love to officially release it soon. One thing is that about our telemedicine application, for now we found out it can be used quite well for triage services in those underserved areas, because those people in those areas, they barely have access to doctors, and oftentimes they don't even know what the problem is with them. And triage is a lot of work. Doctors really need to go to see them individually and tell them, hey, you need to go see this specific doctor. So telemedicine could really work well in that process of medical care, that it will make the doctor's resource more efficient in the specific area, and because patients already know where to go, or what to find, who to find. The other way is aftercare. So it works with it aligns with our collaboration right now in Korea. I'll explain it later. It's about prognosis service. So you get your diagnosis or you get your treatment, then those people, especially like my parents, right? They're old and they have chronic diseases, and their concern is that I feel something's wrong with me. I don't feel good, and they're instantly scared, like, oh, what if it's fatal? And it's really hard for them to go see a doctor every time they have that concern. You have to wait for like 2 hours, and you need to get reservation and all that. With telemedicine application, you can you have all your medical records information there, and you can find doctors who can give you a quick consultation, saying, oh, you really need to go see a doctor. It looks severe to me, or oh, you should try this, and if it feels better, you should be okay. So those kind of casual consultation prognosis service that our telemedicine application could be useful. In between, there are a lot of people like you in Web3 industry, digital nomads, right, who move to places, and places goes to go to different conferences, always traveling, always in different country, and we believe that our application will be a really good fit for Web3 players, especially Web3 players, because they understand that data sovereignty is very important, and they know that blockchain is the solution to it. So that's another way that we're thinking that our application can be useful. So yep, hopefully we'll be able to release it and have you try it soon. Right now we're working on DID generation and storing the health data. Yeah, you mind if I explain a bit more about the prognosis part and what we're doing with DIDs
Yeah, I'd love
right
to hear
now?
more.
Yeah, so we just released a news article. We just released a Medium, and we partner with this. We partner with the biggest health checkup company in Korea. It's called Care, and they have 1.4 million people, the corporate employees, getting health checkup yearly. So it's a lot of data. It's a lot of data that we have access to, and we successfully implemented our DID technology into their system. So again, we cannot just take information, we cannot take data from corporate employees, but we're sending a push notice or pop-up in the Care's application where individuals check their health checkup results, and if they agree to upload their data on our decentralized data hub, then DID is generated, and then we can start onboarding those health data on our decentralized network. Then it can be shared. Then it can be shared to different healthcare providers, or be monetized on data marketplace. So this DID generation was probably the biggest work that we really need to do, because it's really limited to gather data from individuals. First, it's not so refined. Second, it's not verified. It's hard to use those self-generated health data. But this is from actual health sector company with a long history in Korea. All their data is refined and it's ready to be used, and it's coming straight into our decentralized data hub. So again, at most we could expect 1.4 million DIDs to be generated in 1 year. That's the best prospect, but we're probably thinking something less in realistic sense. But still, it will be the unprecedented case in blockchain technology utilized in healthcare sector. So we're the first in the history to do that. I've seen few health data protocols that have similar approach like us, but they're more B2C based, meaning they have solution where individuals can upload their health data. So I think we're the first one in the blockchain history to actually have institutions onboard their data to data on blockchain, which I think is crazy. I know it's not being so recognized, and it's not being recognized so much, but I think it's crazy. I'm really proud of what we're doing right now. We did the biggest part. Now we just have to encrypt the data, build the data marketplace, build ZK filtering feature, so data can be searched without breaching personal identity. Then we're working on that right now because DID is done. You'll be able to find the DIDs being generated on Solana chain. It's also being recorded there. So I would love to share that contract address as well.
Okay, cool. Yeah, send it to me and I'll link it for our listeners. I think that's a really good point that you brought up, and I'm glad that you've highlighted it, because I think to some degree, at least my personal opinion, is that to some degree for decentralized science to really take off and be successful, there does need to be an integration with traditional organization for, I think, for the near future at least, because like you said, that is where most data is held, that is how sort of most systems work. So I like the idea of sort of a Trojan horse of like sort of integrate where you can, make the most of it, and then move towards this really true ethos of data sovereignty, and sort of decentralization and empowered users. And so for my understanding as well, so like kind of the way I'm seeing it is that I know you guys have got an app called Hippo.
Yeah, that is, yeah.
So that would kind of be like, would a user download that app, upload their healthcare data there, and like that would all happen literally on their phone, that they could sit on their couch and do this whole thing?
So right now, Hippodoc app does not have that feature on individuals uploading their data. So we've been focusing on integrating institutional data right now. So we'll probably build that feature soon. Hippodoc right now, our app only have the consultation feature.
Okay, interesting.
But soon, but in the future, yes, that's what we're trying to build. We believe that institutional data is important, but individual contribution, is also important as well. So we're not saying, oh, we do not accept data from you. We accept all data, and you should be able to store it and share it with anybody you want, utilizing decentralized power.
Yeah, I mean, I think just to sort of return to what you said earlier is, I mean, so I am South African. I, have spent most of my life in South Africa, and the ability to sort of bring healthcare onto your phone and to people rather than asking people to go to healthcare services like with this telemedicine sort of, I think is so critical. I think telemedicine, obviously it's a nuanced topic and people have varying opinions on it. But I know in South Africa, it's gotten a lot of purchase recently because, you know, some people like it's they live in rural areas. It takes them 8 hours to go and see a doctor. If they get to the doctor, if you know your healthcare system is not as good as it should be, people can be waiting, you know, up to 16 hours for a consult. And you know, if they need to work and they can't take off those hours, it's just, you know, there's so many ways that I think what you guys are building can really help underserved populations, which I also think remains really true to the DeSci ethos of like sort of leave no man, woman, child behind, you know, empower every person on the planet in their healthcare. So I think it's really impressive what you guys are doing.
Thanks so much. Yeah. So the whole mission is, you know, make sure that healthcare is available for everyone, and then it's casual, you know. We want people to casually be able to have their health related questions be answered. You know, that's what we work on. Of course, we need, you know, traditional healthcare service for, you know, big issues, but we want to make it sure that it's accessible for everyone. And, you know, once you have your data on our data hub, you know, you can share with anybody on our telemedicine application, and any doctors could give you, you know, 24/7 consultation whenever you need it. If it's only shared to one institution, you can only get consultation from there, which is very limited.
Yeah, yeah. So I think actually that even kind of segues into my next question, which is that like you guys have a lot of DeSci principles and, you know, are quite firmly positioned in the DeSci ecosystem. So I kind of wanted to know how you view your role in the DeSci ecosystem, like how you think you fit in, because obviously, you know, this is the DeSci podcast. So we'd love to know.
Yes, I was just waiting for this. So, you know, decentralized science, well, science means many things, right? Some might say, oh yeah, healthcare is not science, but, well, if you look at scientific researches, most of them is related to medical research. So, you know, in my personal opinion, I believe anything related to medicine is quite scientific. When people think science, they think about like, you know, rocket ships or I don't know, nuclear plant. Well, those are all science. But, you know, in reality, a lot, you know, big part of science is related to medicine development or, you know, medical improvements. And okay, so in order for the, you know, medicine revolution, what do you need? You need data that can be used for it. Then you need, you know, medical data, you need health data. So, right now, a lot of decentralized science narrative is really weighted on the decentralized funding part, which I believe is, you know, equally important because it really opened up doors for those niche topic, how to say, research topics. On the other hand, okay, so you have your money, and how are you gonna do your research? Well, you need if you want to cook, you need ingredients, right? If you want to do research, you need raw data. So where are you gonna get the raw data? Well, the traditional institutions didn't fund for your research. Do you think they will open up data for you? Right? It's going to be difficult there. It's another difficult situation. So that's, I think, where Hippocrat comes in as the decentralized data hub for decentralized scientists. So again, we are onboarding health data on our protocol, and you know, anybody anybody should come to our platform and use our ZK filter and get the data they need. So it really, I think it really completes the DeSci, it completes what decentralized science is. You know, funding is one part of science that's being decentralized. Now we need data provision that needs to be decentralized, and we work on providing that raw data for decentralized science. And yeah, it's coming soon, and yeah, hopefully, we hope to see when we're working with Research Hub. I imagined a day where those individual scientists on Research Hub, comes to our marketplace and get the data they need and publish the paper on the Research Hub platform. I think that's a really good example of how complete decentralized science cycle would look like.
Amazing. Yeah, I like this idea of how we can all fit in to help each other. And I think you're totally right. I mean, at Molecule, we are obviously working with a lot of scientific projects, and we see them come through our platform. And, you know, every one of them is going to need healthcare data at some point. It's just the simple truth. And so to have a DeSci Web3 native partner in that would be beyond helpful and beyond valuable. So I really do think there's a space for what you guys are doing. So I think sort of to round off maybe the questions and stuff, and end this conversation on kind of maybe a nice sort of broad scale question is sort of, you know, what is the future that Hippocrat enables? Like, if you can give me a little, like, take me 10 years into the future and tell me how Hippocrat has changed systems as they are.
10 years, all right. So that's a long time from here.
Saying Web 3 years, that's maybe 100 years on.
10 years, I might have a kid, you know. So, well, in 10 years, I should have kids if everything goes by my plan. Anyways,
So as long as you put all your healthcare data, then you'll be good to go.
so all right, 10 years. So again, we just onboarded the biggest health checker company in Korea with expecting, you know, 1.4 million people's data yearly. If that goes well, and we probably will be the first project that actually, you know, shows practical use case for blockchain technology in the healthcare sector. So based off this achievements, we would like to further expand our partnerships with traditional institutions to onboard, help them onboard their clients' data on decentralized storage. And once the data is once the data is bought from the user, so like pharma company or research institutions, data issuers, get part of the incentives as well. It's not just data owners, because data issuing refining is an important job. So I do not see, the reason why, traditional data institutions would not like to join our, protocol, because they cannot do anything with it. But if they onboard it, they get part of the incentives. So again, in 10 years, we probably have all the data institutions onboarded our protocol, every one of them, in 10 years. Every single one of the pharma company, research institution comes to our data marketplace to find the data sets they need. Full compliance, secure, private, no room for no legal issues, safe to use, all consented.
Amazing, yeah.
So that's what we that's what I see, at least in 10 years. Maybe I look too far.
No, I think that's great. I think it's really important to keep your dreams and visions big like that.
On the other hand, we would have 100 dApps that's built on our protocol that utilizes our data hub as well. So telemedicine, what we're building is just one, but I'm sure there are many others with great, innovative ideas that brings that could make our protocol, more practical, or find more practical use of our protocol.
Sort of collaborative building ethos of Web3. I like it. Okay, so for our listeners, I'm sure everyone here is absolutely enchanted by the idea of Hippocrat. And how can people get involved? How can people, keep up to date with what you're doing? And, what would be the most useful thing for you coming out of this podcast, Justin? What would you like our listeners to sort of take away from this and be funneled into?
Well, again, I would like to first the DeSci Podcast listener to really look on the other side of the decentralized science, where about the data infrastructure, and there are like projects like us that's working hard to realize it. That's one thing. Again, there isn't much participation that listeners could do right now, but please follow our Twitter and join our Telegram, and stay updated with what we're doing. And don't miss out on centralized exchange listing as well. Uh, and don't miss out on our airdrop event as well. I know it's small, but it's a small gift to our medium-sized DeSci. I wouldn't say big. It's medium-sized. Well, we'll work hard to make DeSci even bigger than now. Well, I understand that many listeners of the DeSci podcast are also entrepreneurs and leaders of different DeSci projects. So this is a message for you guys. We are hosting DeSci Seoul conference in September in Korea. That's at the same time with Korean Blockchain Week, which is one of the biggest conferences in Korea. So we're expecting a lot of people to come to Korea, come to Seoul, blockchain related. So we're expecting a lot of attendees to our DeSci conference. It would be a great time to really showcase your brand, what you're doing, to share with all the blockchain enthusiasts in Korea. So we're hosting it. Research Hub is co-hosting with us. We are looking for different partners, sponsors who would like to join DeSci Seoul event to really, promote decentralized science in Korea in September. So that's a message for you entrepreneurs and blockchain enthusiasts.
Exciting. DeSci Soul. I'm keen. I want to go. Cool. Thank you so much, Justin, for your time. It's been lovely to have you on the podcast and chat to you. And yeah, I'll check you guys on the flip side.
All right. Thanks so much for your for inviting us. Yeah, thanks so much for inviting me here. It was a pleasure. Let's keep in touch and see where we can collaborate more.